Hi, it's Dr. Mike, and today's video is entitled, Is Fibromyalgia an Autoimmune Disease? So I'll be taking a bit of time first to just explain what an autoimmune disease is and explain a little bit more about what fibromyalgia is. And then at the end of the video, I'll be telling you whether it is an autoimmune disease or not. So I hope you enjoy it. Please note, this presentation is not intended to provide individual patients advice. Rather, it's a way of providing education about fibromyalgia. And if you think that you have a condition that is causing you chronic pain, please talk to your doctor to get a proper diagnosis and treatment plan. So, to start off, we'll first define what an autoimmune disease is. Basically, the immune system can make a mistake and identify healthy cells as dangerous or harmful cells, like bacteria or virus. And then the immune system makes auto antibodies that destroy these healthy cells and tissues, and the body basically begins to attack itself. So this attacking process causes damage to the tissues and inflammation of the affected area. Also, blood tests can usually identify these autoantibodies or immune substances, and that is a way to diagnose autoimmune disease. Also, imaging like X-rays, MRIs, ultrasounds can also show where that tissue damage is, and so we can clearly see the structural changes. So some examples of autoimmune disease: rheumatoid arthritis, systemic lupus erythematosus, Hashimoto's autoimmune thyroiditis, celiac disease, Graves' disease, vitiligo, diabetes mellitus type 1, and pernicious anemia or atrophic gastritis. So there are some examples there. What is fibromyalgia in comparison? It's a neurologic condition that causes pain across most or all of the body. And that basically means that your nervous system is affected, your brain, your spinal cord, and all your nerves. And it seems to cause an abnormal pain. It seems to cause abnormal pain sensations and what they call a central sensitized state, meaning that your body and your brain is experiencing pain in an overly sensitive kind of way where it shouldn't be happening. They don't really know exactly what causes it. And it is a disease that is still actively being researched so that more information is coming across all the time. So the primary symptoms of fibromyalgia are pain or tenderness in muscles, joints, or skin from touch or pressure, severe fatigue, sleep difficulties, or waking up unrefreshed often, and then memory difficulties like kind of fogginess or inability to concentrate, remember things, foggy thinking. And then we get into, is fibromyalgia an autoimmune condition? So it doesn't qualify as an autoimmune condition or disorder because it doesn't cause active inflammation and tissue damage. And as a result, when we do scans of people with primarily fibromyalgia conditions, we don't see structural changes or damage to the tissues. Also, when we do blood tests, there are no antibodies, autoantibodies or immune factors on blood testing. So basically, it can be difficult to diagnose because the two can look a lot like each other. And a lot of the times, a lot of the tests that get done for both conditions are to distinguish, which condition you have. And then you do get cases where you can get both happening at the same time. So fibromyalgia is a diagnosis by exclusion, meaning once you've done tests to rule out autoimmune conditions, if you don't have any of those tests coming back positive, then what you're left with usually is fibromyalgia. So I hope you enjoyed that, and I hope it answered some questions for you. I do have another video in the series called Fibromyalgia X-ray, where we go into that a little bit more in detail. And if you're interested, there is a 10-part fibromyalgia mini course based on these series of videos, and you can sign up for that in the description or in the comment section. And then, yeah, please comment or subscribe to the channel or like it. Look forward to hearing from you.